If you don't check corruption, there's no way you can make any meaningful leap in life.
We talk about the stomach infrastructure policy.
Stomach infrastructure is simply about the welfare of the people, coming to the level of the people.
And the mere fact that you are a minister does not make it to be criminal. No court of law has convicted them.
Dr. Adewole, thank you for joining us on today's program.
You're welcome.
Can you tell me, what are some of the major causes of child and maternal mortality?
Child and maternal mortality, the issues are kind of related. And for a woman, most times the issues cuts across a certain period before she gets pregnant, while she is pregnant, and after she delivers. Now, before she gets pregnant, the issue is whether the pregnancy is wanted. Now, there are a lot of women who have unwanted pregnancies. Many of them will go ahead to terminate the pregnancies, and most times the terminations it ends as an unsafe abortion, which is a big risk for maternal mortality. So you need to be able to prevent unwanted pregnancies, for women to become pregnant if and when they want to. There needs to be opportunities for them to space their children. And then when they finally get pregnant, there should be skilled providers or attendants to attend to this pregnancy, care for the pregnancy, to make sure nothing goes wrong. And then most importantly, when they want to deliver, there should be skilled attendants also to take care of these pregnancies.
Is antenatal care available to the poor? So people who cannot afford medications or cannot afford their prenatal and postnatal checkups and visits, how do they fare?
Now, the problem with maternal mortality is that it happens to the very poor, those who cannot afford these services, those, in areas where these services are not even available. For instance, you find out that in Nigeria, the Northeast has the highest ratio of maternal mortality. Now, the Southwest has the least in Nigeria. And if you look at those areas, you find out that areas that have adequate cover of these facilities, adequate cover of personnel, of skilled personnel, have lower rates of maternal mortality. Now, for the poor, you find out that they are the ones that will have more children. Mm-hmm. They are the ones that will have children frequently. They are the ones that will not access health care, and they are the ones that cannot afford health care. So they are at the mercy of maternal mortality. Now, some state governments and some organizations have come up with ideas of maybe free antenatal care, but that does not really go to solve the problems. And you find confusion everywhere. The same government wants to offer free antenatal care. The same government wants to encourage people to, if you offer free antenatal care, you are indirectly encouraging people to give birth. But we should also look at the area of contraception. People should decide if and when they want to have, if and when they want to be pregnant and have children. So contraception is equally very important. For those who are not ready, they should have access to contraceptive services in order to prevent them from being pregnant. Of course, if a woman is not pregnant, you cannot have maternal deaths. So adequate contraceptive cover, antenatal care, and even in the antenatal care, a lot of things go with it. You have some centers who claim to be doing antenatal care, and simple thing as, say, measuring blood pressure is not part of it. It just makes nonsense of everything. Mm-hmm. So if we are offering antenatal care, the care has to be qualitative care, not just the number of visits. In some centers, they just go sing, clap their hands, and go back. And they have that impression that they've attended antenatal, but it goes beyond that. It includes education, it includes prevention of anemia, prevention of malaria, and treatment of some of these things. And then managing the patient such that the patient has a healthy baby and the mother comes out healthy too.
Dr. Ekbaide, thank you so much for your time.
Thank you very much. You're welcome.
There is a reason Africa is called the new frontier. What was once potential is now an opportunity ready to be seized. Once revered for our resources, today's wealth lies in our people. People who build the cities that shape the future. People who know an idea in one place means business in another. A generation for whom technology means there are no borders, no boundaries. We are the new lions in a brave new world, kings of the urban jungle. And there's a bank that puts the world in our pocket and the future in our hands. UBA, Africa's global bank.
Can you tell me some of the major health challenges that the people of this IDP camp face?
Like the major thing we're really fighting with in the camp here, health-wise, is malaria. We have lots of mosquitoes around, maybe in the night time, because we have a lot of gutters, because the water doesn't have, when we bath, the water doesn't have passage to pass. And catarrh as well, because of the cold. We don't have enough blankets to cover, as in when we're sleeping at night, especially the kids, the newly born babies and the little kids.
You made mention of a doctor that comes and treats these kind of illnesses.
Yes.
Can you tell me what his specialty is, and is he a certified doctor? What is his background?
I don't think he's a doctor per se. I think he's a pharmacist way back at home. So when he came here, he just started as in helping us. When we have little money, we call him up. He comes to check us. If it's something he can handle, he gives us maybe tablets or medicine. But especially the pregnant women, he doesn't really attend to them, because pregnancy has a lot of complications. He doesn't know what is wrong with anybody. He doesn't want to just give any pregnant woman any drugs.
Yeah.
So he just advised them to go to the hospital.
Okay.
Yeah, which is very difficult for us to go to the hospital.
Yeah, so you can't afford it.
We can't afford it.
Exactly.
Even him, we need to pay him, because he's doing it on his own. We need to pay him, so we have to sell the little foodstuffs we have that volunteers, philanthropists bring for us. We sell them to be able to pay for the drugs he prescribed for us. Okay. So we are really facing a very big medical health challenge here in the camp.
You said you're pregnant now.
Yes.
Congratulations.
Thank you.
So what are some prenatal care treatments that you're currently taking?
The last time I went to the hospital, they ran tests and they did scanning. So they gave me folic acid and phospholates and PCM and vitamin C. They said I shouldn't take any other drugs apart from those they prescribed for me, because it might cause maybe, because I told them I lost my baby last time due to lack of medical attention. So they are really taking like precautions on me.
On this. So how often do you go for checkup?
Yeah, it depends. Whenever I go, they give me the next date.
Okay.
Maybe since the pregnancy is not that far, maybe after 3 weeks or 2 weeks, I go back to the hospital.
Do all the pregnant women in this camp?
No.
No.
No. I just why I had the opportunity to go to the hospital because of you. I'm sorry to say, ma, because of the business you gave to my husband. That was why I was able to afford the hospital bill. That was why others didn't have the opportunity I had. That I had because not all of them, had that business this opportunity. Okay. So I really want to thank you for that.
Thank you.
Honourable Minister of Health, thank you for joining us on today's program.
Thank you.
Sir, antenatal care is one of the preventative methods to reduce child and maternal mortality. However, the poorest of the poor in our society still cannot afford this health care. Why is it that in the 21st century, Nigeria doesn't have affordable and quality health care for the poor?
Well, it's quite a challenging thing for us as a nation. But being on this seat, I would not want to look too much to the past. Because when you look too much into the past, you are not going to make much progress. But as a new administration that is people-oriented, that is deeply committed to developing pro-poor programs, we will redress the injustice of the past. And we will make sure that we offer Nigerians qualitative care, irrespective of their status and irrespective of where they live. And one of the key cardinals of this administration is to reduce maternal mortality. Nigeria is one of the worst places to deliver in the world. And we rank at par with some war-torn countries like Sierra Leone, Afghanistan, and so on and so forth. And this ought not to be. Under the new health agenda that we want to put in place, Nigerian pregnant women, particularly at primary care level, will enjoy free antenatal care and free delivery services.
Okay, Nigeria currently finds herself in a huge infrastructural deficit. So how are we going to ensure that people in the internally displaced camps and other remote areas have access to either clinics and qualified personnel that can treat their immediate needs?
We've done a lot of work, and we will want to look at it from two perspectives. One, to look at the IDPs as presently situated, and we also look at the broader context of making sure that Nigerians, irrespective of where they live, access care. We intend to revitalize primary care services across the country. We will operate a universal coverage, adopting the universally accepted concept of one primary care center per political ward. And that will entail that we will offer healthcare services to 100 million Nigerians in the next 2 years, and this will be free.
Many Nigerians have heard these promises before. We've heard past administrations talking about free healthcare, but we never actually get to see it implemented. What distinguishes this administration and past administrations that have made promises but failed to implement them?
Well, I think in every perspective, this is an administration that is completely different from the past. We are serving under a leadership that is totally committed to supporting the poor. We have an agenda that is entirely pro-poor, and as we've mentioned, we will not just make vague promises, we will deliver. And as a proof of concept, we will deliver 100 PHCs, in fact 110 PHCs in the next 3 months.
Next 3 months?
Oh yeah, as a proof of concept. When we flag it off, it's going to be 1 PHC per day, to show Nigerians that we mean business.
We definitely look forward to that, sir.
Oh, we will surprise everybody.
One of our interviews with a doctor, a gynecologist from Garki Hospital, he said that public-private partnerships are what actually works, and it would actually work if we can implement that strategy on a national level. What is your take on this?
We believe in this, but let me tell you that what we presently operate in this country is a pyramid on the tip. And a pyramid on the tip is never stable. What you get at best from a pyramid on the tip is instability. What we intend to do is to resituate the pyramid on the base. The base will be the primary care facility across the country. And as I've mentioned, we will target about 100 million Nigerians across the country. And we will expect the pregnant woman with uncomplicated pregnancy or an uncomplicated past to go there. Only very few, less than 20% of Nigerians will need to access health care at the secondary care center, and maybe less than 5–10% will go to a tertiary center. At the tertiary center, we will want to operate a PPP model. There are so many types of models. So I want to operate PPP models, and there are several types of the PPP models that we have. And we will kickstart with 6 centers across the country. We want to ask them to develop a super specialist facility that will keep Nigerians at home. We also want to change the law on health insurance. Currently, health insurance is voluntary, and we will not get far. So far, we've covered only 6% of Nigerians. But when you have health insurance that is compulsory, that is universal, we will raise the bar, and then we will ensure a situation where the healthy will care for the sick, and where the rich will care for the poor. One of the things we want to do under the Revitalized PHC program is that each of these revitalized, reinvigorated PHC will have a borehole, an industrial borehole. So we offer water to the people, clean drinkable water. There will be solar electricity. So we are going to have the ability to keep our vaccines in safe condition. We will then use these new reinvigorated primary care centers as the focus for community development nationwide. We expect that people will come there to fetch water. Farmers will come there to draw water. Some cattle rearers, some farmers with animals will come there to fetch water for the animals. And by so doing, we will promote a new concept of community development across the country.
What orientation and awareness campaigns does the Ministry of Health intend to run for mothers who hinder their children from actually getting health care due to religious beliefs, and specifically asking for permissions for their husbands before letting doctors treat their children? We've actually found that there are so many situations like this going on, which actually leads to child mortality. So what is the federal government going to do about this?
Let's be honest, I'm sure there are not many of such women who would need permission to care for their children. And there are also some women who will need permission of their husband before going for antenatal care and delivery, but there are not many. It tells us that there is a lot of work to do. But first, we need to make the services available. We have competitors, but I think the best strategy for dealing with competitors is to make quality services available to our people at no cost. When we have such quality services, compassionate healthcare workers, free services, easy access to the facilities, I'm sure our people will go there.
The Honourable Minister, I actually disagree that there aren't much people who actually need these permissions from their husbands to get health care.
There are not many, especially when it is free and the services are there. And we're going to use workers from the community. We are not going to import someone from Port Harcourt to work in Sokoto. We are looking at people in the Sokoto environment who speak the language, who understand the culture. And the new model we're operating will also have villager workers who will oscillate between the facility and the community. So we're going to bond and we are also going to promote ownership. We're going to say this facility is yours. It's not a federal government facility or the state. It belongs to you as a community. And I can assure you that when the services are good, when they're free and the workers are nice, people go there.
I think I agree that affordability and professionalism,
professionalism,
those are definitely key. But
they won't lock the door.
I agree with you, sir. But the specific area of religious barriers, so men don't let other men touch their wives. So a woman can go into a hospital with a fatal case, and she would say she doesn't want a male doctor to treat her, or she doesn't want a male doctor to touch the child.
The primary care facilities will be manned by nurse midwives and villager workers. We will be quite responsive to the sensibility of our people. We will appreciate the cultural differences, because if you do not, people will not use the facilities. We are not going to operate out of vacuum.
Shouldn't there be policies that requires mothers to give attention to their children when they're in dire need, when they bring them to the hospital without actually getting that call?
We can make laws and laws and laws, but implementing those laws can be a different thing. There's a law that compels parents to take their children to school. But to implement that law can be challenged. So what you can only do is to compel, is to persuade and convince that this is something desirable and this is something you ought to have. You cannot really, except you won't prepare to lock them up. And how many will you lock up?
That's true. Okay, lastly, the Dangote and Bill Gates Foundation recently made an investment to the reduction of malnutrition in Nigeria.
They're investing $100 million.
$100 million.
Oh, quite a huge sum.
Yes.
Over a 5-year period.
Wow.
Which to me is very commendable.
Okay.
And we will want to see other Nigerian wealthy individuals emulate them.
Okay. So how's this investment going to be implemented, and what is the reach strategy for this investment?
We're waiting for the details from the two foundations. Okay. They've made the announcement, but they work through agencies, partner with Federal Minister of Health. The investment and the activities will really be concentrated in the northern states, where the percentages of minority children are very high. And to me, that's where we really invest. As a ministry, we've already done something in this regard. We've managed acute malnutrition over the last couple of years. We've targeted about 1 million children. And also in the next 100 days, we'll be targeting another 200,000 children with acute malnutrition. One of the things we want to do is to key into federal government program of giving food to school children, primary school children, a school feeding program. And when you key into that, then you will ensure that our children grow well. That we will make sure that we reduce school dropout rate, and we also increase performance in schools.
Do you have any final words to our viewers?
Well, to say that this administration will unlock the door to poor people, we will provide access to health, and we will turn things around in a way we've never seen in this country.
Professor Issac Adewole, thank you so much for your time.
Thank you so much.
That's it for today's episode of the Osasu Show. We sincerely hope that the increasing rate of child and maternal mortality is cut short sooner rather than later, and the much needed change for sustainable development is implemented across the health sector. We will be holding this government accountable, so make sure you stay tuned to TOS. Don't forget, you can watch all past episodes of The Osasu Show on YouTube and follow us on social media at The Osasu Show on Instagram, Facebook, and Twitter. For more news on sustainable development and current affairs, please visit our website, www.theosasushow.com. Until next week, take care and God bless you.